Are you experiencing sciatica pain? Pain running down your legs, difficulty with walking due to numbness and tingliness in one leg or both leg? Today I'll talk a little bit more about that. I'm Dr. Nelson, physical therapist, and I just recently met someone that had a case of sciatica. All right, so they tried stretching, they tried doing mobility, they tried to do everything in regards to taking care of it in a conservative way. However, they've noticed that over the time that they're continuing to have these symptoms. It's difficult to wake up in the morning sometimes because of these symptoms. And this person was a runner. So what happens when you run? You put a lot of stress on your spine. And when you put a lot of stress on your spine, you put your body more in a compromising situation where you're having disc bulge or you're having things within the spine that can cause the sciatic pain, right? So the sciatic nerve is a nerve that branches off the spinal cord. And when this happens, it can have issues in your low back. So a lot of people think maybe it's from the buttocks region, maybe it's down the leg, but it can start from the low back region where that sciatic nerve initially branches from. So one of my things for individuals that have continual sciatic nerve pain is to get an x-ray of your back. Right, you need an X-ray to see, is there something going on with your spine health? Is there a bulging of the disc? Is there stenosis? Or what it may be that could be causing that sciatic nerve pain. Because usually, if you have sciatic nerve pain and you stretch your piriformis or you do sciatic nerve glides, it should subside. But now you have to go into a next level to really see or uncover what is really going on in your lower back. And as we age and we're running, we're doing all these compressive forces on our spine, it can put it in a situation where we need to take care of the spine health. So take that into account. If you have nerve pain, sciatic pain, glute pain, and you just numbness or tingliness or weakness, or you're having difficulty doing activities that you were able to do previously, maybe you need to go in and try to get an x-ray of your back. All right. Thank you so much for tuning in. I'm Dr. Nelson tuning out.